Honorable Minister of Health, Honorable Ahmed Lamin Samate, the U.S. Ambassador, Madame Sharon L. Cromer, UNICEF Country Representative, Madame Jonathan Lewis, the Director of National Pharmaceutical Services, Director of Public Health Services, colleagues from the Minister of Health, media. Good morning to all of you. And before we go into the meeting or to the handing over, which we are witnessing today, we can kindly pray in our own ways. Then we can go into the program as indicated in the program guide. Can we kindly pray now? Witnessing the handing over of COVID-19 supplies to the Minister of Health by the USAID and UNICEF. Today the 6th of September 2022, and these important items are going to be handed over to the Honorable Minister of Health, Honorable Ahmed Lamin Samate, to support in the COVID response at all levels, from our hospitals, health facilities, and our as well as the communities. So I'm not going to make this program a long one. It's going to be as short as possible, but we will start the statement by the UNICEF representative, Gordon Jonathan Lewis. May kindly come forward to deliver your statement.
I would personally like to extend a very warm word of welcome and appreciation, particularly to the staff of the expanded program on immunization that has really been at the forefront of taking forward the national vaccination efforts in the country against COVID-19. But also to all of the staff of pharmaceutical services who are also present here today, to my very own staff at UNICEF who have been working side by side with your colleagues, Honorable Minister, with your own staff, Madam Ambassador, the media who is here present in such healthy numbers, ladies and gentlemen. It's a beautiful morning, very warm. I'm hoping that it will provide a respite from the intense rains that we've had over the past couple of weeks. So let me start by saying that we are extremely honored to be a part of this handing over ceremony, which we've been planning for some time. The country has recorded tremendous progress in fighting COVID-19, despite significant challenges in the country and other many competing priorities. We've had intensive public awareness campaigns led by communities who are driving vaccinations across the country, and we are encouraging, very encouraging results, generating very encouraging results. Since the outbreak of the pandemic in the country, the COVID-19 pandemic back in early 2020, UNICEF has been working side by side with the Ministry of Health, providing critical support in numerous areas of strategic importance to counter what really has been a profound impact on the fabric of the economy and society in the Gambian population. Through our vast experience in global vaccine procurement and delivery, we have been able to deliver more than 648,000 doses of WHO-approved vaccines to the country through the COVAX platform. Many of those vaccines were actually donated by the United States government. Additionally, we have also provided 1 million syringes since the start of the pandemic. These efforts have been strengthened with the procurement and installation of an ultra-modern cold chain facility equipped with 6 freezers to help the country store any type of vaccine, as well as numerous biological products. That site is right over here to my left. Many of you know it because we inaugurated it early this year. We're hoping that we'll be able to provide you, Madam Ambassador, with a very brief tour of that site after the handing over of the supplies. This is to say that more than ever before, the Gambia's public health system, and it's about strengthening the capacity of delivery of public health in the Gambia, is now better equipped than before to respond to this pandemic as well as other challenges. An important element of the COVID-19 response is supporting the skills and capacities of the numerous frontline health workers who are on the ground day and night responding to the pandemic. That is why UNICEF, in concert with partners such as the United States government, World Health Organization, the World Bank, and others, has rolled out multiple capacity building programs for health workers, technical staff, and social mobilizers. And these trainings have also been expanded to the public, including religious leaders, community influencers, and young people. More importantly, with the generous support of the United States government, which we celebrate today, we are handing over some of the most urgently needed materials and equipment to our frontline heroes. The procurement of these supplies is part of a wider project funded by the United States Agency for International Development that started in September 2021 and covers 4 areas of intervention. Number 1, risk communication and community engagement. Number 2, strengthening infection prevention and control for health workers. Number 3, provision of critical water, sanitation, and hygiene supplies. And fourthly, enhanced data collection and information management. Now, 1 year into the project amounting to slightly over $2 million US, USAID and UNICEF have supported the nationwide engagement of 1,000 religious leaders and other community influencers to increase community awareness around the pandemic. The project has also strengthened the capacity of 1,045 youth and adolescents on COVID-19 prevention to enable them to become social mobilizers to support the country's vaccination efforts. With support from USAID and UNICEF, the Ministry of Health was also able to vaccinate more than 123 individuals in a single vaccination campaign, being the largest coverage registered in any of the COVID-19 vaccination campaigns today. This USAID-supported project has allowed us also to support 22 health facilities countrywide with hand-washing stations, which we are also looking forward to inaugurate shortly with your minister and Her Excellency the Ambassador. Each facility will have 6 hand-washing points and are now fully functional with running water facilitating regular hand washing by staff, patients, relatives, and visitors, thus directly contributing to the reduction of the spread of COVID-19 and other waterborne diseases. And quite importantly, this will also support the national response to the current flood emergency that the country is experiencing. Another critical milestone registered through this project is the provision of a backup solar-powered water system with a tank capacity of 10,000 liters to 7 health facilities, improving access to potable water within the healthcare facilities and their surrounding communities. I am therefore quite honored to participate in this handover to the Ministry of Health of essential supplies donated under the USAID project, valued at approximately US $540,000. The supplies include, and this is not an exhaustive or extensive list, 14 oxygen concentrators, 500 pulse oximeters, 250 infrared thermometers, 330 IT tablets for case management, data collection for use by vaccinators and rapid response teams, 4 laptops to improve data management and record keeping, 3 internal dongles to support data and internet access in the field, and a considerable quantity of wash supplies focusing on infection and prevention control. And let me just say that a lot of these supplies and wash are going to benefit the 76 health facilities, 50 schools, and 80 public places. In total, we're expecting that more than 250,000 people in the catchment areas will be supported and benefited through these interventions. So let me say, Madam Ambassador, to you, to let me thank your government for the generous contribution to UNICEF and the government of the Gambia, which has made possible the procurement of these supplies, but more importantly, the strengthening of the national response capacity to this particular health challenge, but also building on the capacity to respond to future health challenges as we see them. We look forward to building a partnership to help strengthen the Gambia's public health system and expand primary healthcare service to reach one fundamental goal that we all have, which is universal health coverage in the country. The U.S. government, I would like to point out, is UNICEF's single largest donor in regular resource contributions, other resources, as well as we have a very overexcited wind factor today, and emergency contributions as well. So we thank you, Madam Ambassador, for that generous support. Honorable Minister, let me also express our profound gratitude to the Ministry of Health for its leadership, commitment, and coordination of the country's COVID-19 response. At the moment, more than 20% of the country's population has now been vaccinated against COVID-19. But as we've said on many occasions, at the airport receiving vaccines, here on these very same grounds, inaugurating the open cold space and doing other activities, we have all of the required means at our disposal to reach 70% national coverage against COVID-19, and we expect that we will be able to reach that goal before the end of the year. So thank you very much for being here today, and thank you very much for this excellent support. Thank you.
For that excellent statement and also giving us a rundown of the activities that have been implemented towards COVID response in the country. And then really the partners that you have also contracted to work with the ministry have really worked very closely, especially in the area of community engagement and communication. We have really been in touch with those partners, especially social team factory and as well as sector of the Gambia. So really we have really worked in the communities as you have rightly mentioned. We also want to thank UNICEF also for the collaboration in the various sectors, the public health directorate and as well as the National Pharmaceutical Services. The support that's really have been also been great, and there was a strong partnership in the implementation of the plan activities. I now invite the Ambassador, U.S. Ambassador, Madam Sharon.
Of Health, Dr. Amadou Lamine Samate, Gordon Jonathan Lewis, and other representatives of UNICEF, media representatives, distinguished ladies and gentlemen. Good morning, everyone. I am here today to acknowledge and celebrate the strong partnership between the U.S. Agency for International Development, UNICEF, and the Ministry of Health in the fight, the continued fight against COVID-19. The United States makes this donation today of equipment and supplies to prevent and treat COVID-19 and to ensure the continued health and well-being of the Gambian people. These are serious times. No global crisis in our lifetime has matched COVID-19 in scope and complexity. We are facing overlapping health, humanitarian, and economic crises, each global and historic in scope. But COVID-19 will not stop our pursuit of a better future. We can fight back, and we can win this battle. The United States is leading the global fight to end the pandemic, recover from its widespread economic effects, take steps to mitigate future pandemic threats, and build back better the U.S. and global economies, and help and prepare for the future by securing health infrastructure. To date, the U.S. has responded in more than 120 countries around the world with over $9 billion to fight against COVID-19. Here in the Gambia, the United States is committed to partnerships that preserve the good health and future of the Gambian people. As we see it, this is an essential investment in the future of the Gambia. Today's donation of IT equipment, pulse oximeters, oxygen concentrators, and other supplies will greatly assist the Gambian government in helping the most badly infected and protecting others from COVID-19. This donation is the latest of many forms of U.S. assistance provided to Gambians during the pandemic. Since the start of this global health crisis, the United States has donated more than 440,000 doses of COVID-19 vaccines to the Gambia through the COVAX program because safe and effective vaccines are our best tools to end the pandemic. The United States has worked to keep Gambians safe from the virus in other ways as well. Through the USAID Gambia Governance Reform activity, we supported the development of electoral safety guidelines to prevent the spread of the coronavirus during the presidential elections. These guidelines were adopted by the Independent Electoral Commission and were used in all 1,554 polling stations. Using these same guidelines, the Gambia Red Cross Society deployed 1,000 hand washing stations alongside 945 volunteers and 36 staff to polling stations. The U.S. Peace Corps and its volunteers, who returned to the Gambia in June, work with health providers throughout rural communities to prevent the spread of COVID-19 by promoting healthier lifestyles. These efforts, along with many ongoing assistance programs, are part of the United States' continuing efforts to advance the well-being of the Gambian people. Because a healthier Gambia is a stronger Gambia. A strong Gambia will contribute to a better world. Thank you.
We will hand over a sample of the materials produced by the U.S. Ambassador and UNICEF rep. We'll give the materials to the Honorable Minister before he comes to the podium for his statement. Can we kindly get off your houses? Really, we are all happy to see the city here. So take as many photos as possible. I really think that you can always remember this place and remember the items that have been given to the ministry by the U.S. Embassy and as well as UNICEF. I now have the honor and privilege to invite the Honorable Minister of Health, Honorable Hamid Lamin Samadu, to come and give this statement.
Excellency, the United States Ambassador to the Gambia, Madam Sharon Elcrom, the UNICEF Public Representative, Mr. Jonathan Lewis, the Director of Health Promotion, Education, Guy, the Director of National Pharmaceutical Services, the Director of Public Health, the team from UNICEF, the team from United States Embassy, all Ministry of Health colleagues here, ladies and gentlemen of the media, we say good morning to you all today. Madam Ambassador, this is a unique opportunity for us to stand here today witnessing another very important milestone in the collaboration between the United States government and that of the Republic of the Gambia. But please allow me today to mention to you that we woke up with a heavy heart today to the sad news of the demise of our colleague, friend, and brother, the former Minister of Health, Mr. Omar Sy, who was said to have passed away this morning. So we are deeply saddened, and we request you to kindly allow us all to observe a minute silence. Madam Ambassador, the government of His Excellency President Adam Barrow has put the issue of providing quality healthcare services for the people of the Gambia priority. Coming into office a little over 5 years ago, he identified the challenges the health sector was facing. The government inherited very big challenges with regards to infrastructure. We had dilapidated infrastructure, non-existent infrastructure in some areas. We had no or obsolete equipment in many of our health facilities, and we had huge capacity gaps. Considering the fact that no nation can move forward, no nation can develop without having the population healthy. For us to excel in agriculture, in education, engineering, our people have to be healthy. Otherwise, they cannot go to the farms, they cannot build roads. In fact, even if you give them food, really, they cannot eat the food. They can't even enjoy the food. So health is a priority for any government. And developing investing in the health of its people is critical. So His Excellency President Barrow extends his greetings, and he is very delighted that this partnership with health is making progress for the people of this country. We were tasked to do something about what we inherited, because we cannot continue to cry over spilled milk. We have to forge ahead. What did not happen before, probably we are the ones to do that for this country. And that is to improve on the health infrastructure. In that vein, we have started the renovation, expansion, and upgrading of a number of health facilities in the country. We have equally started the construction of new health facilities to increase access, especially to the poor and vulnerable in the villages, in our efforts to achieve universal health coverage in the country. Together with partners, we have stood here a number of times. Jonathan can bear witness to that, receiving a whole lot of equipment and consumables. Now, the government is equally investing in manpower, training a lot of health workers, nurses. Doctors are now specializing in the country. We started a postgraduate training program at the Edward Francis Small Teaching Hospital, which is supported by World Bank. We're training a lot of health workers in other areas, epidemiology, other aspects of public health, all in the vein of strengthening the health sector. We start here acknowledging partnership. We know the partners have been watching. They've been watching a whole lot as to what is happening in the whole country and the health sector. But I think this is a show of confidence for us to receive this item. So if the partners did not have confidence in our ability to make a difference with this item, probably we wouldn't be here today. With all the improvements we've been having in the health sector, one aspect has been very key, very important, and that is ensuring efficiency, accountability, and transparency, because they form the bedrock. Without a transparent, accountable system, no country, no section can develop. And that has been very, very pivotal in our endeavor to revamp the health sector. And I think the partners have been watching. They tend to know a lot more than we do in certain areas, and I think this is a show of confidence. COVID-19 pandemic came as a challenge to the entire world, both developed and developing countries. Economies have been shattered, families have been shattered, dreams were lost, and it was a difficult period. And it is still a difficult period. But nonetheless, within this difficulty, within having similar problems at home, the United States government decided still to stand by the wall to ensure that what is given to the citizens of the country is also extended to the rest of the world. It is remarkable gesture of friendship and compassion to the people of the world. We thank you. For Gambia, it has been a unique relationship. We are very much aware of your government's contribution, national partners, to World Bank, to UNICEF, to WHO, to Global Fund. So indirectly, we know you've been supporting our countries, especially the Gambia, through a lot of strategies. However, we are equally happy that the bilateral relationship is being rekindled, reignited, because we think that it's equally important getting USAID to support the government and the people of the Gambia directly, in addition to what we are receiving through the multilateral partners. So we are happy to have the USAID back on board. And I think, again, this is a show of our strong relationships that are developing under the leadership of His Excellency President Barrow and under the leadership of President Biden and your own leadership. I think it's also a unique opportunity that the bilateral relationship is strengthened further. So you and I will leave a legacy in the health sector during our tenure. So we look forward to that. So in addition, we want to strengthen the bilateral relationship, and we equally thank you for having the Peace Corps volunteers back. They touched the lives of Gambians for so many years, and we actually miss them a lot, and we are happy to have them back. Extend our appreciation to them. But our ambassador is standing here today. We cannot go further without acknowledging the fruitful relationship we've had with UNICEF. Jonathan and his team have been great. They've been there, attending all the meetings, coordination meetings, the strategic meetings, giving us the technical support, and giving us the frank opinions. Because a friend indeed advises you when it is tough and tells you the truth. Friendship is about telling each other the truth. And Jonathan and his team have been there, supporting vaccination, supporting the receipt of vaccines, supporting the actual vaccination process, training our people, giving all the logistics support to the vaccination strategies. And without them, probably we wouldn't be where we are today. And we thank you very much. They've been supporting the water strategy, the water sanitation and hygiene strategies of the Gambia, and that has been receiving quite a lot of successes. In fact, the Gambia is at the pre-elimination stage of ending open defecation. We are very close. I think we got delayed because of the pandemic, and we want to acknowledge their support. UNICEF has built quite a number of public toilets to give conveniences to people around public areas, healthy parks, markets, and highways, and that's also remarkable and exemplary. We thank you very much, Jonathan. The items being donated, Madam Ambassador, today are life-saving pulse oximeters. One pulse oximeter potentially could save many lives. Oxygen concentrators, we know what they need. Thermometers, without them we cannot make timely diagnosis, and without timely diagnosis, probably quite a number of lives may be lost. So these are very, very essential items, and we are happy to receive them. We also receiving tablets, or we received already tablets, laptops, and so on. These will enhance the vaccination and surveillance strategies that the ministry is embarked on, and they will go a long way in ensuring that we get timely data, which is very critical for our COVID-19 response. And we wish to assure you that they'll be put to very good use, and we will, inshallah, the Director of Pharmaceutical Services, ensure that not a single one of them gets lost, because any one of them that disappears, whoever it was assigned to pay for it. I assure you that. And they are all going to be legal so that we keep tracking them. And this is also one of the strategies we put forward to ensure we have a very good inventory process. The Director of Pharmaceutical Services does that to ensure we are aware of whatever items that are donated and whom they were given. Because without this, if things keep on disappearing, we cannot build the nation. We have to add on to what is given before, so that at the end of the day, we have what it takes to change. At this juncture, we would like to extend our profound gratitude to you, Madam Ambassador, to UNICEF, and through you to His Excellency President Biden and the people of the United States of America for supporting the Gambia and for not forgetting the world when the world needed them most. Thank you very much.
Partner UNICEF. From there now we'll come to the end of the session, and then if you want to have some side interviews with the Honorable Minister, you are kindly welcome, and then that can be done after we clear out here, or you can also take the pictures of the materials, and then from there we can have side meetings. So on that note, I would just want us to pray, and then from there we can discuss. Can you kindly pray?